Okay, Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon to all. Okay, today I'm going to present about my study. So the topic of my study is a business continuity management for data outage disruptor, a study of private hospital in Negeri Sembilan. So my name is Noorfarhah binti Maharis. I'm a Master of Science in Risk Management, Faculty Science and Technology, University Science Islam Malaysia. My supervisor is Dr. Rabiha Maksum. So this is the overview of my presentation. So my presentation today will be discussing on the 7 major elements of this is of study. So some introduction of this study. Okay, number one, it's a survey or which done to public hospital in Malaysia in 2019. So as what you can see, government health facilities across Malaysia are in a bad condition. So with frequent power and water outage among other infrastructure issues. So according to the survey conducted between June to November 2019, so amongst 337 respondents from government hospitals and clinics in doctors only bulletin boards, a group of consists of Malaysian doctors. More than half of respondents are reported power outage at their medical facility at least once a year, with 10% reporting power outage every month. So about 4 out of 10 respondents reported their government medical facilities water supply was disrupted at least once a year, with 10% citing monthly water cutbacks. So this is mainly on the power outage and water outage issue survey done in Malaysia's public hospital and clinic. So the second study was done by Anne Mariliana et al. 2018. From the study, it shows a major weakness of the healthcare industry in Malaysia. So the business continuity management was not clearly stated in most of the organization's written policy. This was supported by a study done on insufficient hospitals' preparedness to respond in crisis, and it is believed that to a certain extent, the preparedness attributes of hospitals towards disaster resilience are insufficient, and the results could serve as indicators for the public hospital stakeholders in Malaysia to improve its preparedness and enhance its resilience. So the address issue in this study is non-availability of business continuity plan for private healthcare industry in ensuring the business continuity during any disruption event. So this study is conducted to facilitate the organization's process in developing a reliable business continuity plan for their business continuity management. So the problem statement in this study, the first one is healthcare is a critical and complicated industry that is vulnerable to a variety of risks and disruption if risk is not adequately managed. The second one, a major weakness of the healthcare industry in Malaysia, the business continuity management was not clearly stated in most of the organization's written policy. The address issues in this study is non-availability of business continuity plan for private healthcare industry in ensuring the business continuity during any disruption event. So let's go to the research objective and the research question for the study. So number one, RO number one. So RO1 is to investigate the internal and external business environment. RO number two, to assess vulnerable threats to hospital, and RO number three, to develop business continuity plan based on the vulnerabilities. So these are the research questions developed referring to the RO. Okay, RO number one, the research question is what are the internal and external business environments for the hospital? RO number two, what are the vulnerable threats to the hospital? And RO number three, how to structure the business continuity plans. The significance of this study will be an important endeavor in ensuring efficiency and good work environment in the workplace. In addition, This study will also give significant. This research has a substantial impact on the healthcare industry's degree of preparedness for situations involving vulnerabilities or threats, which have an impact on the entire company operation as well as the level of care provided for patient care. Business continuity plan is also critically important to all healthcare industry to ensure their level of preparedness in handling any crisis situation. So these are a few of the literature review for this study. The first literature review is reflecting on the developing and determining BCM strategies. The step within the BCM life cycle is the development and implementing BCM response and disaster recovery plan. The results is to be documented in an executable plan as soon as recovery requirements have been defined with the help of BIA and relevant continuity measures have been selected. HALS 2007. The second one is on the business impact analysis. Okay, a few study has been done. The first one, BIA is seen as a process for understanding an organization in order to prioritize and implement continuity strategies and BCM plans. The second studies, the following phase can typically be distinguished in a BIA. Number one, identification of critical products, process, services. Number two, identification and characterization of functions or activities that support the delivery of critical products, processes and services. Number three, identification and characterization of resources that each activity or function depend on. Characterization of functions or activities is often done by estimating the maximum tolerable period of destruction, MTPD. So from the literature review also, okay, this is the a framework by KPJHB, BCM Framework 2021. As you can see here, there are 6 identifying process, identifying dependencies, RPO, RTO, minimum business continuity objective, MBCO, and also MTPD. So next one, we go straightly to the methodology of this study. Okay, this research design is using a qualitative, cross-sectional study design. So the study setting is done at one private hospital in Negeri Sembilan, and which is the private hospital is an accredited hospital with MS2H and JCI. The hospital is also a hospital which practicing an enterprise risk management. So the data collection for this study is using a survey questionnaire and a self-administered hard copy and Google form. So for this study, we are using 27 respondents from multi-operational department, which is experienced head and managers. So the study is using a stratified purposive sampling. So the data has been analyzed using a descriptive analysis and a structural framework modeling. So there are 4 phases for this study. The first phase is on environmental analysis. The second one is strategic formulation. The third phase is strategy implementation, and the fourth phase is strategy review and control. The first phase consists of basic and governance and also business impact analysis. The second phase is focusing on strategies and solution and also business continuity plan. The third phase is on the exercise program, and the fourth phase is on sustaining business continuity management. Business Impact Assessment, BIA, based on the Business Impact Assessment questionnaire, this study achieved clear understanding on hospitals' department functions, dependencies, continuation requirements, their available contingencies plan, record of previous failures, list of strategies and solutions for each type of crisis, and finally, sorting out the top vulnerable threats which require a business continuity plan. On the data analysis and results for RO number 1, these are the services key function from the 27 operational services. The second one is on the internal and external dependencies. So these are the 27 internal and external dependencies. And the next one is on the previous failure. So these are the 27 previous failure which has been listed by the operational services. So next one, we go to perceived vulnerable threats. So these are some given vulnerable threats for the healthcare industry. And from here, so we have come up with a total number of priorities and the average score. As what you can see, these are the priority, and the priority is based on the list is the highest priority. So based on the BIA, the top disruptors which requires the business continuity planning are: number 1 is on the fire, relocation of service. Number 2 is on water supply disruption. Number 3 is on data or network outage. Number 4 is on the loss of key personnel. And number 5 is on the power outage. So for data analysis and results for RO3, based on the RO2 results, a BCP on network and data outage was developed as follows. So as what you can see, this is the BCP developed. So the BCP activation criteria has been spelled out inside the BCP. For more than 15 minutes system or data outage at the critical business function or services, high severity at any moment of business operations or multiple services regardless the severity level. Experience system or data option for more than 15 minutes. This BCP contains complete guidelines for all services in the event of full or partial network outage crisis. As a conclusion, this study identified and established a comprehensive BCP in case of data or network outage happens in hospital. Hence, this practice could be adapted in other healthcare organizations as well. The framework are certainly an advantage over the paper-based records when it comes to maintain precise and accurate information of hospital critical services. The adoption of BCP within hospital settings may help to ensure swift business recovery and continuity in facing such crises. The research sample size may be expanded to a larger group of samples as it will produce a more accurate results from the analysis. This research data have been collected at the private hospital, and the findings of this research are not solid enough to represent the vulnerabilities in other hospitals due to differences in environment and management method, which may lead to different outcomes. So as a conclusion, this is the references as well. Okay, so with that, I end my presentation. Thank you.